I feel like all I have to say is Medicare and that Geraldine's gonna do it, and then I can just walk off and you guys all know what's gonna happen. So I am very, very excited to have Geraldine. She did a CEU talk for us yesterday. So Geraldine is a pharmacist, as well as you are board certified oncology pharmacist, thank you. She is one of the founding members of NMAPA with me and is on our board. She's our treasurer. What else? You got a certified Medicare benefits counselor. I could go on and on about her resume. However, Geraldine to me is, let me explain this. So I have parents that are Medicare age, and anytime I have a question, anytime I don't understand something, Geraldine is my person. She has personally helped my in-laws and my mother, as well as countless other people. When I have questions, she's my #1 go-to. I've never met someone who knows the ins and outs of Medicare so well. So see how everyone's coming to hear Medicare and come running? I'm telling you. I'll get you your clicker. Okay. So I'm proud to have Geraldine here. Save time for questions because there's always a bunch when it comes to this. So with that, I'll go get your clicker. You can get started.
Hi. So I guess I'm like first up after the keynote speaker. That's great timing. Good timing for a Medicare talk, because who doesn't want to hear about Medicare at 3:15 in the middle of the afternoon? Okay, so yesterday, how many people do I have? Okay, does it sound like really loud or is it just me? Good, okay. How many people were in the CE yesterday? Okay, good. So we talked a little bit about the plan finder. So today we're gonna go in a little more depth. I wanted to be able to do it live and through the internet and go through the different screens, but wasn't able to do that, so I took some more screenshots. But it's going to give you kind of a better idea of what you're able to do with the Medicare Plan Finder. So all starting places lead to Medicare.gov. So you can find just about anything you need at Medicare.gov, but down there at the bottom, there is the find plans. Somebody asked me yesterday about, when you switch somebody to a different plan, what about providers? They've now added that find care providers to it. If you create an account, you can save your favorite providers and include that into the plan finder mix. So we're gonna just go ahead and start with find plans, because that's what we want to do. Okay, so again, you can log in and create an account, or you can do it without logging in. It's going to be more detail oriented to the patient if you have their Medicare number off of their red, white, and blue card, and then you also need the date of their Part B enrollment, so the month and year that they were eligible for Part B, and then you'll need their zip code to create an account. But we're just gonna do this like we're not creating an account, like we're gonna do it without logging in. So it's gonna ask you a few questions, and so you have a variety of things that you can ask for. I think I might have to come down here. Oh. Okay. So you have the ability to look for different things, an Advantage plan, just a Part D with a Medigap, or just a Medigap only. So if you just want, if you're just starting out with somebody new and, or you want to refer somebody to the website, there's always this option that they can look at the different Medicare options like we broke down in detail yesterday, which is they can either do original Medicare, A and B, and then if they want drug coverage, they're going to have to add a Part D, and then they're also going to need a supplement, because otherwise that 20% is unlimited with no cap. The alternative to that is then a Medicare Advantage plan, which is quote unquote a Part C plan, but it's A, B, and D all smashed together. You can't get Medicare Advantage plans without a Part D plan, like if you have retired employee benefits that provide drug coverage, So there are some Medicare plans without Part D. But for the sake of time, since we only have 30 minutes, and I am long-winded, I know that, we're going to do a Medicare Advantage plan and act like they have a Part D plan rolled up into it. So the first thing you're going to do is you're going to put in their zip code, because you got to see what, these are all privately insured companies, so you need whatever plans are in the area. And then it's going to ask if the patient gets any help with the costs from any of these programs, because that's definitely going to change the outcome of the costs using the plan finder. But again, for this sake, we're just going to say we don't get any help right now. Okay, so this is probably one of the most important things you can do, is to make sure you, if you're able to, if you have an accurate list or a semi-accurate list, is to go ahead and start loading the drugs into the Medicare Plan Finder one by one. So this obviously is a cheap one, but I've got a list loaded in here. Then you're actually able to choose up to 5 pharmacies. The reason this is important is because some of the pharmacies are in network with that plan, some are not. Some are preferred, some are standard in network, some are not in network at all, and that's going to affect the outcome of the drug costs. So yesterday I was talking, and I want to make sure that I get this information out to everybody. So open enrollment for Medicare is October 15th to December 7th every year, and that's where you can change your Medicare Advantage plan, your Part D plan. The only thing you can't change is a Medigap during that time frame. But if you have a patient who is desperately in need, where you need to lower their drug costs, or maybe they just have Medicare A and B and you want to get them into an Advantage plan, you can enroll a patient in a 5-star plan any time of the year. It's not limited to open enrollment. And this is important. Like, I'm sure on the infusion side, you probably see a lot of Medicare A and B only patients, not a lot, but some Medicare A and B only patients, and that's a dangerous place to be living in for them, with no cap. So here you can see at the top, you can filter the plans by the different, either by the the insurance carrier, the drug coverage, the star rating. If they need a special needs plan for like end-stage renal disease or something like that, you can filter it out by that too. And so these are, in that area, these are the 2 Medicare plans, Medicare Advantage plans that are 5-star plans. So if I had a patient right now, because it's not October 15th yet, I could enroll that patient into either one of these plans because it's a 5-star plan. Okay, so then if I wasn't going to go by star ratings, we'll get rid of the star ratings, we'll go back to the original. It's going to list probably 20, 25 different plans for Medicare Advantage plans. And so you can take up to 3 plans and compare them next to each other. So down at the bottom, you can see I took the AARP Medicare Advantage, the Humana, which I love Humana, so I had to put Humana in there, and then Kaiser, which is one of the 5-star plans. And so let me just preface this also by saying, just because it's a 5-star plan and I can get them into that 5-star plan does not mean it's the best plan. It might just be to hold me over until open enrollment, until I can find a better plan. But at least I get them into a plan. That's the important part. That's what I use the 5 stars for. So here we go side by side. It'll give you kind of a breakdown of what the copays, what's covered. Somebody was asking me yesterday about skilled nursing facility. This would be a way where you could compare the costs of the skilled nursing facilities. Diabetes supplies is a big one. 2 of the 3 don't have any copay for diabetes supplies, but Humana, obviously they do. Again, this is more information, just comparing side by side. As you can see, the out-of-pocket max is different on all of these. So on the AARP, it's $4,500 in network. The Humana Choice, because it's a PPO, so because it's $4,500 in network because it's an HMO. So there's no such thing as out of network. It's either covered or it's not covered. So, but on the Humana Choice, which is a PPO, you've got that option for in network or out of network. And so if you look at their out of network max, it's $11,000, which is still pretty steep. And then $5,200 in network. Now, I say $11,300 is pretty steep, but when you get into the oncology arena, at least I've got it capped at something. I mean, some of these drugs, could cost the patient $3,000 to $4,000 every 3 weeks, and that adds up quickly. So at least there's, that's the whole point of getting them into a Medicare Advantage plan when we're, that late in the game, is just to put a cap on it. And then Kaiser, they're in network. They're also an HMO. Out-of-pocket max is $3,800. The Part B premium is going to be the same for everybody, which is $148.50, and it's going to go up again in 2022. And then down at the bottom, the plan features. This is just kind of a quick checklist. If you were looking for specific things, like sometimes I'm looking for dental or vision or hearing for people. So if I see it X'd out, like they don't have anything for dental, like I'll keep on scrolling and pick another plan. The other thing that would differ here is the drug premium. So on 2 of them, there's no premium. On the Kaiser, which is the 5-star plan, the Part D premium piece is $37.40, so that's in addition to, that's in addition to the $148.50. And then the drug plan deductible part is different on each of them too. So the higher the drug plan deductible, the more help they're going to get when they're in the coverage gap. So, a lot of these people, I was saying yesterday, they get lured into these 0 premium plans, but then in the end, they end up paying more in the long run, and we'll see that as we go on. Here's all of your Part B. All of your Part B services, and they all differ per plan. As you can see, so, when you're looking at just Medicare Part A in general for hospital services and SNF, it's going to differ than what your Medicare Advantage plans are going to pay. So if you have a patient who's a frequent flyer in the hospital, like who is maybe a heart failure patient or diabetes or end-stage renal disease on dialysis and is, constantly in the ER and then admitted, you want to look at the inpatient hospital coverage and also probably the skilled nursing facility too. Then you keep scrolling down and you're going to get to the drug coverage and costs. And as you can see, there's quite a bit of difference between the AARP Medicare Advantage on the far left, right? Yeah, far left. And then the Kaiser on the far right. So I picked 4 pharmacies. They're all preferred in-network, but look at the cost difference. So this is like probably one of the easiest ways to cut your patient's drug costs is by, like every year at Senior Services, every year we would love for seniors to come in and just have their, load all their medications into the plan finder again and make sure we have them on the right plan, because the formulary can change at any time without notice. The cost, the tier level, anything, it can all change at any time. So for this particular patient with the drugs that I loaded in, the AARP Advantage plan is going to be the most cost efficient for them. Okay, then I think I kind of jumped ahead a little bit, but so we talked about this a little bit too yesterday as far as, oh no, I'm sorry, I think I went back. There we go, okay. So just a little bit more about the pharmacy cost levels. There's the in-network, there's the standard pharmacies, and then there's the out-of-network, and then there's the mail order. So this is for the Anthem one. So the 3 retails are standard in-network, so you're going to get preferred pricing, but the mail order is really the preferred method of getting their prescriptions, and it's going to be lower for them. But that, that's going to, so what you have to understand also is that depending on the plan, they're all going to have different preferred pharmacies. So Medicare in general doesn't have preferred pharmacies. Each Medicare Advantage plan has their own preferred pharmacies. So you kind of have to do a little bit of digging to find out, based on the drugs, based on the pharmacy, based on the plan, how much you can save the patient. But here you can break it. So you can just keep, in this plan finder, you can just keep breaking it down even more granular, which is really good. But it can also be very confusing too. But so pretty much the costs on all of these, this is for the Anthem plan or the AARP plan. All of the costs are pretty much the same across the board, except for it's 0 cost for mail order. But these are on the generic drugs, which don't really typically cost very much anyway. But if we look at, this one is the Humana plan, you can see, so I put insulin in there. So some plans will have a special rate for insulin and some won't. So if you have a diabetic patient, it's important to find the plans that do have the special lower rates for insulin. So, and that's really what kicked the price up on this plan is the insulin. And then on the last plan, which is the Kaiser plan, the prices, actually, I mean, they're not going to pay anything for insulin if they do mail order. However, you can see with the Myrbetriq and the Xarelto is one that a lot of patients have difficulty affording. That really, they've obviously assigned that to a higher tier level, and it's really not going to change no matter which pharmacy they get it paid for at. However, mail order is still the way to go if you wanted to go Kaiser. Okay, now you can, so this is kind of a bad time of the year to actually take screenshots of these slides right now, because if I were to do this in November, December, I'd be able to show you a whole breakdown of what they would pay per month, January through December. But right now, I'm only able to give you a snapshot of the rest of October through December. But this is what they're going to pay for their yearly drug costs plus the premium, and then when they're going to meet their deductible. And so typically, depending on the combination of drugs, if they had a specialty drug and it was January, they'd meet their deductible they'd meet their deductible in January. They might even meet their catastrophic cap somewhere around February, March. So then it will tell you also how much they're going to pay per month for the rest of the year. But in this case, they're not going to meet their deductible. Okay, so the coverage phases, Part D gets really tricky. You've got the deductible phase, which is $445, so they pay 100%. So you can have some Medicare Advantage plans where there's a higher premium, but they don't pay any deductible. And some patients get really hung up on that because they can't afford that whole $445 out of pocket in 1 month. So they'd rather spread it out over several months with their premium. That's okay. There's nothing wrong with that. It's really their preference. And then there's some who would rather not pay the premiums and then just pay that $445 deductible. The other thing I didn't mention yesterday, but the Part B premium is automatically deducted from their Social Security check or whatever is transferred to their bank account. Part D is not. So if there's any additional premiums that go along with the plan, whether it's Medicare Advantage or a Part D plan, they literally get a bill for it every month. There is a way for them to have it withdrawn from their checking or banking account, but for senior citizens who are not well versed in how to set that up, they're having to mail in checks for their monthly premiums, which is not really convenient. But anyway, so for the coverage phases, you got the deductible. They've got to pay 100% of that $445, and then after the deductible, they enter into this initial coverage phase. This ends in 2021. It's going to be different for 2022, but the initial coverage phase, they have to meet $4,130, and it's by tier level. And then once they meet that $4,130, then they enter into the catastrophic cap phase where they pay 25% of brand or generic until they hit $65.50. Once they hit $65.50, then they pay 5% of the cost of the medication, or $3.70 for generic, and I want to say $9 something for brand name. But as you can imagine, some of these drugs, 5% is a lot of money, even when you get into the catastrophic cap. So it's not like they're really safe once they hit the catastrophic cap. They're still subject to, paying $500, $600 easily. But in 2022, it's going to change again, and I'm surprised that they didn't. I guess I get so many emails from Medicare. Like MedicareInteractive.org is a great website. You can find a lot of stuff on Medicare.gov, but I don't feel like they break it down into really understandable terms or in an understandable way. And so I like MedicareInteractive.org, and they also give like little case studies. So if you go to their website, you can sign up for their emails, and they'll email you the information. I'm just surprised I haven't seen more information come out about the change in the coverage phases, because the deductible is going up, but once they hit the deductible, in the initial coverage phase, they're going to pay 25%. So they're going to pay 25% whether they're in the initial coverage phase or whether they're in the coverage gap. So, however, the catastrophic cap has now gone up as well. So I think the new catastrophic cap they have to reach is $7,050, somewhere around there. So, so it could be I'm not, because some of the tier levels are so low, I'm not sure how this is going to affect them, with them having to pay 25% of everything instead of going by the tier levels. So now you can break it down even further if they, and some of these, I'm not sure how many of you work with seniors, but the seniors that I work with, they want to get very detailed. They want to see the cost. So at Senior Services, the way we have it set up is we have a desk, and I've got my screen, and I've got a screen that faces them, so they can see everything. They want to be very involved, which is great, because I think it's unfair for seniors to enter into the Medicare realm without having some sort of counseling up front. But this way they can see like what their costs are going to be in the different coverage phases. And then here is an example of the tier levels. So we've got the preferred generic, the generic, the preferred brand, the non-preferred brand, and then the specialty tier. And I'm sure a lot of you guys live in the specialty world with the specialty tier, which makes it really, really difficult to predict what the cost of these medications are going to be. And then if you want to know what tier each of the medications fall into, that's available on the Plan Finder website as well, which is nice because, so I kind of have a little bit of an advantage, because if I see a drug, I'll just say like there's Xarelto and Eliquis and something else, another blood thinner. But let's say one plan has one of them as a tier 2 and has the other one as a tier 3. I'm going to want to see that, and then I might even be able to talk to the doctor about switching to a like from Eliquis to Xarelto if it's on tier 2 or something like that, so that it's a little bit cheaper. So it's just nice to know what tier level it falls under. Is it a preferred generic, or is it just a generic? So yesterday I was talking, like, each plan has to have 2 drugs from each class on their formulary. So like for ACE inhibitors, they would have to have lisinopril and ramipril, but they don't have to have fosinapril. So fosinapril could be a non-preferred generic, but the other 2 would be preferred generics. And so I could call that doctor and say, hey, can we switch it to lisinopril or ramipril, like, to make it a preferred generic, and then it's either no cost or $2. So it's always good to know what tier level it is. And then the very last thing, and we talked about this yesterday as well, is, I don't understand how Medicare has gotten this far and still has such horrible benefits for hearing, dental, and vision. Most of them will pay for a cleaning, but a lot of these patients, they'll have abscesses, they need extractions, they need glasses, obviously, they need hearing aids. They either don't cover it, or they might pick up 50%. They might pick up only $200. You can buy an additional rider through that insurance company's plan, so that you can get some additional coverage. But to me, so far, what you pay in monthly premiums, you don't really get back in the additional coverage for those things. So it's supposed to be improving soon. I'm hoping to see that, because I feel like besides medications, that's probably the next thing that they're going to need. So I think that's all I have for slides. So that was Medicare Advantage. Now, you can go back, like if they just need a Part D plan, or like, let's say they're already enrolled in a Part D plan, and it's open enrollment time, you can use the same plan finder and go in, enter in all their drugs, and pick the plan they're currently enrolled in, and then compare it to other plans and see if there's something else out there. If you pick different pharmacies, you pick different plans, to see if there's a way to decrease their drug costs. If they're new to Medicare, then you can use the plan finder for just about anything, whether it's getting into a new Medicare Advantage plan, if they just need Part D for some, I can't imagine they just need Part D, but if they need Part D and a Medigap, you can also use it for that. The latest thing that they've added, which is really great, is the Medigap portion, which is the supplement portion. Before that wasn't available, and we were having to use these booklets. And yesterday I wish you guys were all here for the talk yesterday. The talk yesterday was much better. I had so much more information. But for the supplements is also a Medigap. The supplements, they're lettered A through K, maybe L or maybe N. Okay, so you can have 50 letter G plans. So I always use letter G because I call it the Cadillac plan because it picks up the most things, like the Part A coinsurance, the Part B coinsurance. The only thing the supplements don't pick up are Part D coinsurances. But I can have 50 different Part G plans. They all have to offer exactly the same thing. And so, but if you look at the premiums are all over the place. So I've got, Anthem charging $1,600 a year for one Part G plan, and then I've got Aetna charging $1,100 a year for another Part G plan. And there's absolutely no difference in these plans whatsoever. So the thing is, the patients, they just don't know any better, because right around this time, your patients, their phones are blowing up by brokers. And I will do all this work to get a patient into a plan, locked in, like we're happy with the drug costs, happy with the supplement, happy with whatever. And along comes a broker with a random phone call. And that age, they pick up the phone for everybody. They still have a landline. So, and then the broker starts telling them all this stuff about how they can get this and this and, these extra things, and promising them. So, that's how they get lured into these plans that really don't offer them any additional benefit. They're just paying more money, and they don't know it. Because they don't know, and I wouldn't have known this to shop around for a Medicare supplement, or that you have any sort of option when it comes to picking a Medicare Advantage plan and having this much flexibility. I hope what this shows you is how much flexibility there is in the plans, and how much more control you have over it than you think you do. Because I know, as a pharmacist, I just thought, actually, I didn't know how they got enrolled in a plan until a couple of years ago. So, but yeah, with the plan finder, it really does give you that flexibility. But for the Medigaps especially, so one thing to think about with the Medigaps or the supplements is they've got 6 months from the time they turn 65 and they're enrolled in Part B. They have 6 months to get into a Medigap plan without being subjected to medical underwriting. So this is when, if you've got a patient with cancer or another chronic illness, this is the time to get them into a supplement.